Most women have heard conflicting messages about receiving hormone therapy after menopause, and that confusion is causing many women to needlessly suffer.
And today, the U.S. Preventative Services Task Force published some new guidelines on the use of hormones after menopause. Our Dr. Frank McGeorge is here to explain exactly what they had to say and really, more importantly, what they did not have to say.
Exactly, Karen and Jason. So, at menopause, levels of estrogen, an important female hormone, naturally decrease. Now, because this occurs at an age when many women also begin to have other medical conditions like cardiovascular disease, cancers, osteoporosis, diabetes, and even dementia, there was interest in whether hormone replacement could prevent some of those conditions. And the general consensus is no, but it's not that simple.
This recommendation states that asymptomatic women who are in menopause do not need to use hormone therapy as preventative for any kind of chronic conditions.
That's Dr. Carrie Leff, a certified menopause provider at Henry Ford Health. That means, based on existing data, hormone therapy is not indicated to prevent cardiovascular disease, cancer, fractures, diabetes, dementia, or other chronic conditions. And often, there are non-hormonal treatments for these chronic conditions. Also, hormone therapy after menopause can increase the risk of stroke, blood clots, gallbladder disease, and urinary incontinence. But as Dr. Leff points out, that's not the whole story.
Menopausal hormone therapy is safe and effective in patients who are struggling with symptoms of like hot flashes and night sweats, and also something that we call genitourinary syndrome of menopause, which is a super common condition in women over the age of 50. Most women, like over 75% of women as they transition through menopause, are going to have some symptoms. So this is not just something that's super uncommon. What we don't want women to hear is that hormones are bad and that hormones are a risk to your health. It's we like to individualize treatment as menopause providers.
Now, another important message that Dr. Leff wants women to hear is that there is a difference between systemic hormone therapy, like oral medication and patches, compared to local vaginal estrogen that is safe in virtually all women and will significantly help the large number of women who suffer from vaginal dryness and irritation during menopause.
Okay, so I've never heard of a certified menopause provider. So what does that mean, and how do you find out if they're certified?
Well, so it actually means that your provider, and they don't need to be a gynecologist, has gone through additional training with the Menopause Society of North America, so they're really better suited to approach menopausal symptoms and therapies. The website, menopause.org, can actually help you find one of these providers, but it can be very helpful if you're facing postmenopausal issues.
Very much so.
Good to know.
Yeah.
Thanks, Doc.
Thanks, Doc.